The Ford government is preparing to launch its plan to give private clinics a bigger role in Ontario's publicly funded healthcare system. The plan means some surgeries and scans that are covered by OHIP will be performed in independent clinics instead of in our hospitals. Our Queen's Park reporter Mike Crawley joins us now with more on this from the legislature. And Mike, although there's been plenty of criticism of this move, some doctors are actually out now in support of it.
Yeah, Dwight, and I actually tried to seek out some doctors who were in support of this plan because we've heard a lot from the critics. I've done a lot of coverage about the concerns that there are about the program. And so we thought really to try to give all sides of the story, we talked to some doctors who are in favor of the plan. A hip replacement in progress at Toronto's Humber River Hospital. The surgical teams here have their operating room running so smoothly that they now do a hip replacement on the typical patient in just 35 minutes.
We're able to help 14 people today that are all going to go home within the same day, which is, pretty unique.
Hip replacements are among the OHIP-covered surgeries that will soon be performed in independent clinics outside of hospital under a new plan by the Ford government.
When it comes to your health, the health of all Ontarians, the status quo is no longer acceptable.
These three doctors all support the Premier's plan.
When you restrict surgeries to being only done in the hospital, it really limits the access for patients to care.
The sky's the limit as to what we can do. We can take a tremendous amount of pressure off of the hospitals in many different areas.
I think there's much to be learned by looking at other healthcare systems and not be scared by them.
These physicians all point to countries with universal healthcare, like Australia and Sweden, where many publicly funded surgeries and scans happen in private clinics.
What all of those systems found were both efficiencies in terms of the cost of delivery of care, improvement of the quality of care, and they absolutely tore through their wait times.
While Ontario's wait times for most surgeries are among the shortest in Canada, they're far longer than in countries where independent clinics take on some of the work.
These models of care exist all around the world. We're not inventing anything new here in Ontario. We're actually playing catch-up.
One big concern from critics of the plan, Ontario's hospitals are already facing a staffing crunch. So when nurses and doctors move to these clinics, how can things not get worse? The physicians answer, in a specialized clinic, staff will be able to work more efficiently than they can in a general hospital.
Hip and knee fit perfectly into this. It is basically a very repetitious procedure.
They're taking a lot of the work that is kind of grunt work out of the hospital and letting the hospital concentrate on what it needs to concentrate on, which is complex care.
Now, the official voice of Ontario's doctors, the Ontario Medical Association, is in favor of the idea of creating independent clinics outside of hospitals, but they insist that those clinics should be run on a non-profit basis. Dwight?
So, Mike, explain some of the situations when a person would get their surgery in one of these clinics rather than in one of our hospitals.
Right, so Dwight, we'd be talking about outpatient surgeries only, or day surgeries as they're sometimes called. It would only be certain types of procedures, and also it would be healthier people, generally, folks who aren't necessarily at risk of big complications, folks who don't need the full support of an acute care hospital.
So doctors that support this move, they talk about these clinics being more efficient than our hospitals. So can you get into a bit more detail about why that might be?
Yeah, Dwight, it's kind of about specialization, almost like an assembly line sort of model. The idea is that these clinics would specialize in certain procedures, and you'd have, these nurses and doctors doing the same thing over and over and over again every day, and they would just simply be able to put more people through the operating rooms than they can in the hospitals. Also, like less time getting people in and out of the operating rooms in these clinics. Here's what I heard a little bit more from Dr. Litchfield, the orthopedic surgeon.
For example, the average orthopedic surgeon in Ontario would perhaps operate 7 or 8 days a month. 7 or 8 days a month. And I think that would shock most people in the public. They would assume we're in there operating every day. We're not. Despite 2-year wait lists in several geographic areas of the province, we're not operating every day. We're operating 2 days a week, sometimes a day and a half a week. So there is days where we have downtime and we should be operating. We should be doing something else. We just don't have enough OR spaces or grid time within the public system to allow surgeons to really maximize what they should be doing.
Another factor on efficiency would be that these clinics wouldn't be affected by the kind of patient surges that you see in hospitals, which often lead to the postponement of scheduled surgeries like these kinds of things.
Just to finish up, Mike, do we have any specifics on where these clinics might be or how many of them or when they'll start operating?
Yeah, those questions haven't been answered yet, but the government has said that you can expect that these clinics are going to go in parts of the province where the wait times are higher than the provincial average. We're going to find out more around the late spring when the government actually puts out a call for proposals to create these clinics. Dwight?
Mike Crawley is our senior Queen's Park reporter. Thank you, Mike.